Welcome to News Radio 600 KOGO. Lou Pate here with you, along with a new member of the team, Crystal Martinez, as producer, joining the show. Welcome aboard. Look forward to working with her, and as always, with the whole News Radio 600 KOGO team. Coming up in our second hour, we're going to have a very special presentation of our Wisdom of Solomon Hour. Aaron Solomon will join us to talk about the world of politics, the aftermath of the school shooting, what's going on with the Russia meddling investigation, and so on and so forth. But first, we're going to switch gears a little bit tonight. We have the Olympics going on. There's a lot going on with the USA female hockey team. Men's team's kind of bombed out. You got figure skating, you got speed skating, you got skiing. There's just a lot of sports activity going on. The Olympics are a fun time for Americans to gather around the TV with their family. But not just that. There's injuries. There was a Austrian snowboarder, Marcus Scherer, broke his neck. And that's a major injury. But if you're like me, you know, I'm a runner. So when I run, I got my ankle injuries, my knee injuries, my hip injuries. There are sports injuries that you don't have to be an Olympian to get, whether it's bone, whether it's soft tissue. And in the spirit of the Olympics, I welcome San Diego's own Dr. Josh Jagoda to the show. He is with San Diego Spine, Sports, and Wellness. Dr. Josh, welcome to the show. How are you?
Great. Thank you for having me. I appreciate it.
Now, Dr. Josh, did I get your name right? I hate to flub someone's name.
Jagoda, yes. I think you had it right.
Dr. Josh Jagoda. Thank you. San Diego Spine and Sports Wellness, unlocking human potential. Now,
That is my goal.
You're going to help us out here because I'm a runner. And I always talk about I run my 7-8 miles a day. And then there's times where I have... Yeah, it's pretty good, especially for someone in my age category. But I have to occasionally retire into the house, one due to the Florida heat, but also after a few months, my knees hurt. But before we I don't want to get to me. I don't want to make this about me, Dr. Josh, because
okay.
At San Diego Spine and Sports Wellness, you deal with people who are training for the Olympics, but you also deal with everyday Joes such as myself. Now, I mentioned Marcus.
If you're talking families, you're talking people who are athletic, you're talking elite athletes, everywhere in between.
I mentioned Marcus Scherer. He was the Austrian snowboarder who broke his neck, but closer to home, American skiing sensation Lindsey Vonn, back in December, suffered a back injury in a World Cup race. Now, you see these types of things, you know, Lindsey Vonn, big name. She's been a gold medalist since she's age 19. You know, now we had Red Gerard, gold medal in the half pike with the snowboarding. He's 17. Dr. Josh, when you're 17, you can't be hurt. Your body doesn't know what hurt is when you're 17. But
that is incorrect. These are athletes at the highest level. I mean, these are the pros of the pros. So they have a different mindset. They have a different body type. They are just, and when you're talking about sponsorship, you're talking about your life on the line. You're talking about something they absolutely love to do. There are no limits for them, so they will push themselves past. And that is exactly why you saw with this guy who broke his neck. He got back up and finished off the race.
I'm amazed at that.
You know, I mean, you think about that, and I mean, you could have talked about somebody having neurologic damage or go, you know, and get paralyzed. But no, this guy just got back up, finished off the race on his own, and then got medical attention.
Now, as you mentioned, these are Olympians at the highest level. And you know, we joke a little bit, but many people, such as myself and everybody listening to News Radio 600 KOGO, they work out. And I take my workout very serious. I do it 6, sometimes 7 days a week, trying to stay a step ahead of Father Time. And I have injured myself. Sometimes, Dr. Josh, I've injured myself without knowing it. What are the most common injuries that you see at San Diego Spine and Sports Wellness for regular Joes like me and people listening to News Radio 600 KOGO?
So every injury or every sport we talk about, it has its associated problems, right? So if you're talking about running, right, you're talking about lower extremity, hip, knee, foot, ankle, things like that. But if you're talking about a baseball player, the likelihood of them having plantar fasciitis or patellar tendonitis, that's more than likely not going to happen. So you're going to see a whole host of different injuries based on the sport. So it's really sport specific or hobby specific, depending on what you want to call it. But at the end of the day, it is based on what the actual activity is.
Now, when the Olympics come around, do you see an uptick? Do people get into it? Is there a wave of people that say, hey, I got to start working out? Or do you see more patients when the Olympics come around, or Super Bowl, or something something that grabs the national imagination? Do you see more people?
I will say for sure that you saw it a few years back when Michael Phelps with the cupping, and he had his own commercial about, hey, I'm over 30 and I do more recovery than I do training. And that's when you saw a huge surge. And especially with the summer sports as well, with the volleyball, you saw the kinesio tape going on. That's when you really saw a surge in it. But in the Winter Olympics, I don't really see the surge, but maybe it's associated with, maybe the actual New Year, people trying to get in. That could be one of it. But it just seems like it brings people together, and people are inspired by it. So you're right. I do think there is a correlation. People do get inspired by the Olympics.
But now people, obviously you're in a warm climate, I'm in a warm climate, San Diego, best weather in the country, and there's more outdoor activity going on there. But people do, we'll get away from the winter stuff but they do go up to Northern California, and they'll go to Colorado, they'll go skiing and so on and so forth. But in your practice as a chiropractor, again, I should tell people, it's San Diego spineandsport.com. What do you see? Is it you have spin classes, we have all of these different activities going on, CrossFit gyms and various versions of CrossFit gym. My girlfriend belongs to it's not CrossFit, but it's one of those type of boot camp workouts.
Yeah, they're really popular right now.
Let me tell you, the stuff that they do that she tells me, the workout today is going to be this. I think I'm in decent shape, but I'm slender because I'm a runner, but I don't think I can do some of the stuff that they do. And a lot of people in her class, they get injured. Some are more, someone rotator cuff thing, but a lot of it is muscle and tissue tears. Do you deal with that? Do you see that a lot?
That is our bread and butter. That is exactly what we see every single day. Anywhere between disc pain, nerve pain, but mostly we're treating the tissues to really allow these people to heal. But we do see a lot of low back pain in all aspects of sports. I mean, 80% of Americans are going to follow, or if not Americans, if not the world, are going to follow some sort of debilitating back pain at some point in their life. So that stat is already against you.
Well, I'm looking at your website, and of course you have a lot of nice pictures. But one of the pictures is a female. She's in a gym setting. It looks like she's lifting something above her head. I see the climbing ropes. I see the bars where you go across like in the Marines. These CrossFit gyms, and I'm not going to say CrossFit, but these boot camp style gyms. I don't want to get sued by CrossFit, Dr. Josh.
Oh, no, we don't.
We don't. They're powerful. But are you finding with these boot camp type camps out there that there's more injuries? I mean, what's coming in to see you?
That is a great question, and as soon as I say something, someone will argue with me something else. But at the same time, these things are promoting a great host of health and wellness, and these people are really losing weight. They're improving their mobility. They're actually becoming in tune with their body for the first time in a long time but at the same time they're talking about lifting weights, and we're talking about repetitions for time, and that's where you start getting some breakdown when people are pushing it past their level, and they have this great camaraderie, and they're like push, but at the same time, are they pushing too much? And that's where sometimes I see they push till failure. And I'm talking about not failure, I can't lift the weight, but they push to failure where their technique is bad, and then they overload tissues over and over and over again. And then they come in like, I don't know, I just picked up a basketball on the floor and my back went out.
Well, I laugh because I actually threw my back out once. I lifted my leg up to put my sock on, and I pulled something, and man, I went down like a box of rocks.
Did you blame the sock?
I was putting a sock on, and I pulled a muscle in my back, and I went down like boom. That was it. I didn't even get to put the sock on. And I was laying there. I couldn't move.
Those are the movement patterns that have been hidden, or the absence of symptoms doesn't mean the absence of a problem, right? So you might have had something going on for quite a while, and it just didn't happen, and finally the tissue just got overloaded and said, I'm not doing this anymore. I can't do this anymore, and it just went out on you. And that's what people, so when people go running and say, I heard it running, really, most people didn't heard it running or picking up the pencil on the floor. It's been a culmination of years and different activities and things they've done improperly that have really compounded, and that's why they got that injury.
All right, hold on. Dr. Josh Jagoda, we are talking with him. He's with San Diego Spine and Sports Wellness in the theme of the Olympics. I thought, and my having recent sports injuries, I thought, well, if I'm hurting and my girlfriend's doing the boot camp in much better shape than me, Dr. Josh, I figure it's happening to other people. But you can check out Dr. Josh at San Diego Spine and Sports Wellness, the website San Diego Spine and Sport. We'll be right back. If you have a question for Dr. Josh, give us a call, 800-600-KOGO. You are listening to Lou Pate here on News Radio 600 KOGO. Welcome back to News Radio 600 KOGO. Lou Pate here with us with a special guest, Dr. Josh Jagoda. He is with San Diego Spine and Sports Wellness. I encourage you to check them out at SanDiegoSpineandSport.com. In the spirit of the Olympics and in the spirit of my growing old body, we have Dr. Josh on. He comes highly recommended, and I encourage you to check out his website there. Dr. Josh, back in September when we had Hurricane Irma here in Florida and there was no air conditioning, and I literally was sleeping on the floor in like 95% humidity and 95 degree temperature, and gasping for air by the door, I literally woke up a few hours later, and you come highly recommended from many people that I know from when I lived in San Diego, and I literally sat up and I joked about it on the air like the next week. I was telling one of the guests, I was like, Dr. Josh, where are you? Because I just couldn't move. I laid down fine and I sweating like a pig, but then I was so stiff when I woke up. What causes that? I mean, from healthy to not in like 3 hours time of just laying on a floor, it shouldn't be.
Yeah, and before we went on break, I was saying how sometimes you have these movement patterns or these faulty movement patterns that are just coming up over and over and over again, and we ignore them because there are no signs of dysfunction. Just like a flu or a cold, we get a sore throat. Those are signs of an infection or some sort of problem going on within the body, right? Pain is a sign that we're injured. And if we don't have pain, we don't pay attention to these signs or symptoms, right? And so that's where, boom, you woke up one night, I'm in pain, you can't move, you have the stiffness, the soreness, and it kind of knocks you out. And then you're like, whoa, I just slept on the floor. And it's more than likely, that could be part of it, but at the same time, you have to realize that your patterns that you've had over the last couple of weeks, your stress levels, the fact that you haven't maybe stretched enough, maybe you didn't get enough recovery time, maybe you weren't doing the right exercise at the right time, maybe you're overloading yourself. And that's where people don't realize is that the lack of symptoms, as I said before, doesn't mean the lack of a problem or the absence of a problem.
I know I do this, so I'm assuming that many other, I'm as average as they come, so I know many people do this, is that I feel, so like I last year I remember I had, it was a feeling in my left hip, it was hurting, and I ignored it. I put some muscle rub on it, and then I just kept running, and after a couple of weeks of doing that, of course, then I hurt myself and I had to take some time off. Is this common? Do people don't want to admit that something is wrong, whether it's a torn tissue, whether it's tendinitis, numbing, tingling, anything, even down to what you deal with as a chiropractor, headaches and migraines. Is it common for people like me, you ignore the symptoms and you keep pushing yourself and then you end up hurting yourself even more or injuring yourself?
Absolutely. It is more common than you would ever expect, so you're not alone on that one. And what's people think it's going to go away. And I have a rule of thumb with people is if it's 7 to 10 days and it hasn't gotten away on its own, it's more than likely not going to. So that's when you have to start taking action. And that's where YouTube and all these other internet things help and hurt yourself. And so some people go on the internet and they check things out and they're doing great things for themselves. And then on the other end, they're doing the same thing, but for an injury that actually needs some work on a different area. And so they're making the injury worse and worse. And then they come in and say, I've been ignoring this for too long. And it just becomes a problem because they're letting these tissues and their mechanics and all these motor skills that they do or don't have slowly get worse and worse and worse over time, and then they finally can't take it anymore, and they reach that point of no return, and that's when I see them. So I'm urging people to say, hey, listen to your body, just like you have a sore throat. Start taking action on these things immediately. Make sure you're making the positive changes now before it's too late, because it's much more treatable in the earlier stages than if you wait too long.
Now at San Diego Spine and Sports Wellness, you had mentioned to me, Dr. Josh, and we don't have to give any names, but you're working with someone who's training for the Olympics for figure skating. Now, superstar athletes who make it to the Olympics, they have to train just like we do, right? Whether I'm going to run the marathon in the Summer Olympics, you have to start out one step at a time, slowly. Although you're working out every day. I noticed that friends of mine, when, it's like we just passed New Year's, and, well, it's just a month and a half ago now, and people say, I'm going to start working out, I'm going to start eating better, I'm going to lose 25 pounds, instead of saying I'm going to lose 5 pounds, and they push it. They push it too far, whether it's weights, whether it's cardio, whether it's, joining a gym, and then they hurt themselves. Do you find that happening after the first of the year, by around now or late January, people coming in because they overdid it after the Christmas rush of Christmas parties and buffets?
Absolutely. I actually see it a little bit more in when I was living on the Northeast, it was more in April, just as the warmer sports started to come up. People have been dormant for the first 4 months of the year, and then they start going outside and boom, they hurt themselves right away. But out here in Southern California, it's kind of more like a steady stream. People are active all the time, so you see people getting hurt all the time based on their sport.
All right, now we just got about a minute left, and Dr. Josh, I have some more questions, but can you hang out with us for the next segment, please?
Absolutely.
All right, our special guest is Dr. Josh Jagoda. He is a chiropractor at San Diego Spine and Sports Wellness. They're on Mission Boulevard. Check them out at SanDiegoSpineandSport.com. When we come back, we're going to talk about tears that you may or may not know you have. You'll know the pinching and surgery that may come from them, the pros and cons of working out too much, and the recovery and training that pertains to soft tissue, which is Dr. Josh's specialty. And, of course, if you have a question for Dr. Josh, you can. 800-600-KOGO, 800-600-KOGO. There can never be too many good questions that come about when it comes to your health, when it comes to working out. Everybody thinks, I'm just going to start lifting weights, I'm going to start running. Next thing you know, it's like weights, pop, this, you're tearing soft tissue. And you could be I learned this the hard way, trust me. When I was doing weights for about 4.5 years straight, I was tearing tissues that I didn't even know I had. And you want to avoid that the best you can. Lou Pate here with you, along with Crystal Martinez, producing the show, our maiden voyage together here on News Radio 600 KOGO. Welcome back to News Radio 600 KOGO. Lou Pate here with you, along with Crystal Martinez Miranda, our new producer here at News Radio 600 KOGO. Welcome aboard. It's our first time working together. And we also have as a very special guest, Dr. Josh Jagoda. He is a chiropractor at the San Diego Spine and Sports Wellness Center. They're right here on Mission Bay Drive. You can check them out at SanDiegoSpineandSport.com. We're talking sports. We're talking sports injuries. Everybody's twisted ankles. Everybody's pulled muscles in their back. And as Dr. Josh said earlier, if you did like me, pull out your back while putting on socks, that means there was something there before. I never actually thought of that. But Dr. Josh, I'm looking on your website at SanDiegoSpineandSport.com. I'm laughing because it says here, common conditions treated, and I'm going down the list. Meniscus tears, knee pain, sprains, strains, nerve impingement, numbness and tingling, tendonitis, bursitis, rotator cuff frozen shoulder, headaches. I don't stop. I've had all of that until I get to carpal tunnel. Yeah, carpal tunnel is the only one I didn't have, and I don't even know how carpal tunnel makes the list. I'm wondering, Dr. Josh, why do I work out? Because I've had all of these.
Well, the whole goal of working out is essentially just to make sure you're strong, and so that when you do an activity, you can go through these ranges of motions. You can actually go and do that activity, complete it, perform well, and recover at the same time because if you don't have these muscles contracting at the right time, you're going to have bad, what we call neuromuscular control. You're going to have bad mechanics. And that is just going to be a setup for a problem in the future with regard to strains, sprains, all these other things that you just mentioned. And really, at the end of the day, it's just to live a healthy, active lifestyle. We're designed to move. We're supposed to move. And so you should move, and you should really keep your muscles and tissues healthy.
Now, someone told me, and I don't know if this is true, that just sitting in an office chair, the L shape of the body, is not a good position. And so many of us do it in offices. I'm doing it right now, sitting in the studio. It's not. Is it true? It's not good because of all the pressure on our lower back just by sitting. Because everybody thinks of sitting as something to take the weight off, relaxation. But I was told that all the pressure when you sit on your lower spine is not good.
That good old saying is too much of anything is not good, right? And so too much sitting 8 hours a day, you have to factor that into people's lifestyle. They work for 8 hours a day at a computer. They sit an average of a 21-minute commute each direction. They go home and they eat for another hour, right? Maybe lunch. They get up and walk a little bit, and then they sit down at home to watch the TV at the end of the night. So you're talking about 12, 14 hours of sitting. How can that be good when more than half of the day you're seated? So right then and there, you're taking pressure off of you, but you're actually deconditioning your body. So get up, walk around, contract your core. Don't keep these muscles in the shortened position. If you're sitting on your butt, you're deactivating those glutes, which is really, really strong for stabilizing the lower back. Same thing with the core. You're not engaging the core when you're seated. So these two things alone, with some other problems, you're going to eventually end up with some lower back pain or upper back pain.
Now, even for people, Dr. Josh, for people who don't even work out, and we're not giving medical advice here because that would end up with lawsuits, but do you recommend even if someone doesn't work out, just to do some stretches, some very basic stretches in the morning?
Absolutely. There's a lot of research out there nowadays saying that you don't have to, quote, work out. I highly recommend that people do, but the more often you work or get up and move throughout the day, the better off you're going to be. So if you stay stagnant for 60 to 90 minutes, that's a good indication. Get up. After you're done with an hour of straight work, maybe you're focusing really well on doing your activity, fill up your water bottle, go to the restroom, make sure you take a walk for your lunch break. The more often that you can get up throughout the day, the better off you're going to be because you're constantly engaging these muscles. Take a flight of stairs, park an extra 100 feet away from the grocery store. These are all going to help you.
Now, Dr. Josh, I'll tell you, I joke about a lot of things, but many, many years ago when I was a young man, not that I'm old now, Dr. Josh, but I'm just, not in my 20s anymore, but I was in my early 20s. It was a car accident. And I don't talk about this too much. I don't hide it. It's something that's in the past that it's just kind of, anyway, a friend of mine was driving, he crashed, and everybody got banged up pretty bad. I ended up fracturing 2 vertebrae in my neck.
Oh my.
And I was told I would never walk again. I'm walking fine. Like I said, I'm a runner.
You're running.
And I find that if I don't run and if I don't do basic exercises, and I'm in South Florida, so I can't run in July and August outside. That's why I have a treadmill, which I call my torture machine. Actually, I'll tell you this. A couple of months ago.
Hamster wheel.
The treadmill. Yeah, I got the MP3 player. I got the TV. Oh, it's so monotonous. I love running outside, but Actually, just to give you an idea of how much I use my treadmill, a few months ago, the motor broke. I had to get it fixed, and I didn't know how to check the computer because I just get on it. I don't do any of this fancy stuff that it can do. I had 13,516 miles on it, and that's not counting. That's not counting the 6 or 7 months I run outside. But back to these.
Beautiful.
So I had the 2 fractured vertebrae, and they told me I would never walk again. And I know at the San Diego Spine and Sports Wellness, you guys deal with recovering of soft tissue. Obviously, I had a lot of damage all over the place there. But if I don't work out, if I don't do even basic calisthenics, that's when it bothers me. That's when I can feel the old injury. And I wouldn't say it's pain. It's just like a pain, like annoying because I could feel it. It's like this pressure. It doesn't feel right. But if I'm in a regular routine, and I'm not talking about like breaking records, just a regular routine of working out, it doesn't bother me. Does that have something to do with the deep tissue, or what is it?
Yeah, I mean, there's so many different levels of where we can approach that from, but at the end of the day, what you're doing is you're promoting blood flow. You're promoting nutrient exchange. You're flushing the bad stuff out, and you're bringing some good stuff in, right? And you're also really just helping the motion of the movement, helping all the muscles glide and slide past each other. And, you know, a lot of people are going to talk about arthritis, and these are common symptoms of arthritis, is that one of the best things for arthritis, you wouldn't guess it, is actual movement. Because you're talking about the fluid or the synovial fluid that's deep within the joint. Those are what secretes when you actually move. So one of the, I don't want to say cure, but one of the treatments for arthritis is exercise. So you can see how these kind of play an intricate kind of response of, hey, I'm stiff, so I go exercise, it feels better. And then when I don't do anything, it just allow it to not perpetuate that movement, and then now you start getting this tightness and all these things going on. Aside from that, movement is actually shown to inhibit pain over and over and over again. So, you know, and that's all on a neurologic basis right there. So as soon as you move, you're going to start slowly inhibiting pain. You ever walk into a drawer or something like that late at night, stub your toe?
Oh, sure.
What do? You rub your toe. You rub your foot. What happens to the pain? It slowly goes away. And then as soon as you stop rubbing it, what happens again? The pain starts coming on again. Then you start rubbing it again. And what happens? The pain goes away. So that's sensory input. That's movement to your body. That's stimulation to the body that inhibits pain right there. And you can see that on just such a I ran into a door type thing. But now you apply this to a movement pattern. And that's really where people go from I couldn't walk for 4 years, and now I'm actually running, and that's where you see these long-term people get really well over the course of years.
Okay, now the basic thing that we've all had is swollen ankles, twisted ankles. Everybody has twisted their ankle. Even when you're not working out, you could be walking down a flight of stairs or walking across a room and you roll your ankle. Everybody's done that. I've heard so many different things. Take your shoes off, keep your shoes on, ice it right away, elevate your foot over your head for circulation. Okay, you don't have to be an Olympic athlete like you are helping someone. You don't have to be an average workout regular Joe like me, which you deal with at San Diego Spine and Sports Wellness. Not even working out. People who are listening right now to News Radio 600 KOGO, they roll their ankle, they twist their ankle. Dr. Josh, what do? That's the most basic thing that everybody has to deal with, right?
Yes, and there's this acronym that we come up with in the medical terms. It's called RICE, rest, ice, compression, and elevation. However, the new terms are now MICE, movement, ice, compression, and elevation. Now, you are supposed to rest a little bit, but research is showing that the more you move, the earlier you move, the better your chances are of recovery. So if you ever see or heard of somebody who had a heart transplant or open heart surgery, what is one of the first things they do after the surgery? They get them up walking, whether it's with an aid or with a walker or with both. They get them moving right away. So you want to start moving the affected joint, preferably not weight-bearing or very minimal with bands or something like that. You don't want to go back to your full-blown activity. If you rolled it running, you're not going to start running on it right away. You're going to want to start doing some movement, and then you can use this ice, compression, and elevation as well.
Now I feel like I keep bringing it back to me, but
it's okay. We all know.
I am my own example. I did tear a meniscus in my it was my right leg. They did an arthroscopic surgery. This was in San Diego when I lived in San Diego. And if it happened now, Dr. Josh, I'd go to you. I didn't know you at the time.
That's all right.
Okay, so
I'll forgive you this time.
My next knee tear, you got it. But I was told that, and again at your place at the San Diego Spine and Sports Wellness, you were telling me when we first talked this afternoon that you deal with recovery and training of the soft tissue.
That's what we're specialists on.
But I was told by the surgeon that time that I said, when can I run? When can I run? He's like, well, it depends. Your healing, your rehabilitation, your physical therapy, all that kind of stuff. He said, but you will have scar tissue in there that you may not feel, but it will be there for upwards of 6 to 9 months. And, of course, I was younger at the time. I didn't believe him. And I went running much sooner than I should have, and good thing I didn't damage it. But that's a long time. Is that about right? It could be scar tissue that we don't feel pain anymore, 6 to 9 months.
Absolutely. And scar tissue, if you view it as, I guess you could say, a ball or a knot in the muscle that we hear about, what it's really going to do is it's three-dimensional. It doesn't just go on the top or the bottom, left or the right. It actually is like a spider web. It sinks into the muscle and to the joint, and it doesn't allow things to glide and slide properly. And so what we're doing when we do soft tissue work or specific soft tissue work to these specific areas, first you have to obviously assess the right area and make sure you're doing the right thing, but we're breaking down the scar tissue. We're promoting the ability for these muscles and these joints to glide and slide. We're creating what we call a controlled environment or controlled inflammation, because we're actually breaking down the tissue as well as healthy tissue to re-stimulate the healing process, to make sure that when you do your rehab, when you do the soft tissue work, that it re-heals itself in the proper alignment and the proper pattern so that you can do what you need to do.
Final question, Dr. Josh. I read that being sedentary is one of the unhealthiest things that you can do. It's right up there with smoking and drinking too much. Being sedentary, never moving, being the ultimate extreme couch potato, even though you don't, and you might not even smoke or drink, but that is very detrimental to your health. Is that true?
Absolutely. They have a word for it. It's called deconditioned syndrome. And it's pretty much the guy or the girl who doesn't do enough for themselves, and they're winded when they go upstairs. They're winded when they do this. They're winded when they do that. And at the end of the day, you're just causing massive atrophy to your whole body, to your brain, to your muscles, to your blood flow. And if you can't get this blood flow into your body, you can't get this movement, there's no way you're going to live a healthier life.
All right. Well, hey, Dr. Josh Jagoda, we appreciate your time, your expertise.
Thank you for having me.
Radio 600 KOGO. San Diego Spine and Sports Wellness, everything from Olympians training for the Olympics to regular Joes like me who just beat up our body. I encourage you to give Dr. Josh a call or just check out the website, SanDiegoSpineandSport.com. He's right here. He's local. Dr. Josh, thank you again, and appreciate your time.
Thank you so much for having me.
All right. We'll take a quick break. We'll come back. It's News Radio 600 KOGO. Welcome back to News Radio 600 KOGO. Lou Pate here with us once again. Thanks to Dr. Josh Jagoda. And we appreciate his time. San Diego Spine and Sports Wellness Center. Coming up at the top of the hour, it is going to be the Wisdom of Solomon Hour. Aaron Solomon will join us and we'll be talking about everything that's going on in the world of politics. People are probably saying, Lou, you're talking about sports and the Olympics and sports industries and all of your workouts. It's not what you normally do. Hey, we got to change it up a little bit, Every once in a while, throw you a curveball. But we're going to be talking about the sad aftermath of the Florida shooting just a few miles away from right where I'm sitting right now, Parkland, Florida. Students heading to Tallahassee, to the state capital. For those of you listening in San Diego do not know, Tallahassee is the capital of Florida. Students are going there, 100 of them. I don't know why they didn't fly them, to be quite honest with you, because they're coming from Parkland, like I said, a few miles away from where I am here in Delray Beach. They're going to Tallahassee. It's like 400 miles, maybe a few more. So it's a long car ride or a long bus ride or a long van ride. These kids just experienced the craziness of being chased around their school with a nut with an AR-15. I thought somebody would, shuttle a private plane or something like that. So we'll be talking about all the politics that is involved in that as well when Aaron Solomon, who's a conservative blogger, will join us. And we'll also talk about the Russian meddling. 13 indictments, kind of a big dud, flame out, really nothing. No Americans, no campaign people from the Trump campaign or any campaign, actually. Bunch of people stealing identities, opening up PayPal accounts, and now basically getting caught for, well, I wouldn't want anybody to steal my identity, but these are low-level crimes considering that you are being accused of trying to throw a presidential election. So you stole identities, you opened up illegal PayPal accounts, and you bought advertising, 56% of which was purchased after the Olympics. I don't see the crime. I mean, I see the crime, and they should be punished because it's horrible when you have your identity stolen. But how many millions did it cost the taxpayer dollars? How many millions of dollars did it cost taxpayers there to get a bunch of people basically for identity theft? So we're going to be talking Russia. We're going to be talking the aftermath of the school shooting with the only man who can bring the brilliance of Solomon, the wisdom of Solomon. Aaron Solomon will join us here in the next hour right here on News Radio 600 KOGO. And, of course, if you would like to get in on the conversation, you can do that as well. 800-600-KOGO. Lou Pate here with you. You are listening to News Radio 600 KOGO.